Hi, I'm Dr. Macklin. I am a Reiki Master, life coach, and board certified physician. And I want to share with you 3 reasons why I decided to go into Reiki healing. Now, a lot of people have asked me, you're a doctor. Why is it that you would go into something that sometimes you have to read between the lines with what people are saying. They would ask me, why would I go into something that clearly doesn't pay as well as what you already are practicing in now? Sometimes they would ask in a way, like in a backhanded way, like, why would you start to practice something that didn't have scientific evidence behind it? Isn't that a spiritual practice? Or how does that have to do with medicine and healing? And how does it heal? So the first thing that I want to address is, one, before I get into the first reason, and first of all, I just want to set this up and say, this is going to be a 3-part series because I want to speak in detail about the 3 reasons why I decided to start this business. So like I was saying, the setup in terms of how Reiki healing works and what it actually does. So it is thought of as either energy healing or spiritual healing. I like to think of it as both. And it is an energy that comes in and works with your body's own energy field, especially the chakra systems. So there are 7 centers of energy throughout the body, and you've probably seen these diagrams with the silhouette of a person, and there being balls of light of certain color lined up in a row vertically in the body. So these are chakras, and they all represent that particular area of the body and certain aspects of life in terms of their energy. So these are energy centers that start to develop. The first chakra, which is at your base, starts to develop when you're about a year old, up to your 7th year of life. And as you continue up the body to the crown chakra, these areas develop appropriately during the time that the child or adult is developing that aspect of themselves. So what the energy does is it comes in and it works with your own body. One way that we think that it works is through activating the vagus nerve, which helps to calm and soothe the body. It's part of the autonomic nervous system that settles you down. We call it the rest and digest phase, as opposed to its opposite, which is this sympathetic nervous system, which heightens you, which gives you the energy and the adrenaline that you would need to flee from danger or fight. So we think that it works through the nervous system, or the vagus nervous system, to ease the body, calm it down so that it can heal itself. And essentially Reiki healing works on anything. It works on mental health issues. It works on bodily functions. So blood pressure, if your blood pressure is too high, it'll function to lower it, and vice versa. If it's too low, it'll function to raise it. So it really will work on anything that you intend it to and what is needed. It has no side effects. It doesn't hurt. There are really no downsides to it unless you really do not believe in it. That's really the only thing. It's not necessarily that it hurts you if you don't believe in it, but it just doesn't really take effect if you are resistant to the energy. So that's how it works. Very rudimentary definition or explanation. So I found while I was practicing that people who believe that they could get better and believe that they carried the power in their hands to get better actually did. So not only did they come to me seeking out tools, whether it was through medications or occasional injections and other minimally invasive procedures, they also applied the tools that they knew to apply, such as healthful eating, coping mechanisms that were favorable and facilitated healing as opposed to facilitated continued disease. And let me actually back up and tell you what my specialty was or is. My specialty is chronic pain management, and my primary specialty that I started off in was anesthesiology. But what I worked in was chronic pain management. And most of the people who have chronic pain, they can have a difficult time in finding relief. They can have a difficult time because it is so complicated. It includes the mind, it includes the emotional body, it includes coping mechanisms, whether you have positive coping mechanisms that help you or coping mechanisms that actually dig you deeper into the cycle of pain. Chronic pain management or chronic pain involves the nervous system, so the central and peripheral nervous systems that can start to cycle in a way that's dysfunctional and continues this cycle of pain. It also includes various aspects. So what we have to do in chronic pain management is incorporate multiple different ways of treating. So one should be in cognitive behavioral therapy, which is a way in which it's a psychological approach to managing coping mechanisms. So sometimes people can catastrophize or overgeneralize, which can, like I said, dig them a little bit deeper into the cycle and continue the cycle of pain because they expect for the pain to continue, and they think that perhaps something is wrong with them, which is why they still have pain. And somebody's outside and my dog is growling. Anyway, it's over. The other aspect is that we want to have people in physical therapy or doing exercise on their own. They should be taking some sort of medication. I mean, they don't have to, but some form of medication, usually not opioids, because opioids tend to make things more complicated, and there's a risk to people's lives with accidental overdose with taking opioids, so we don't recommend those. But usually some sort of medication that maybe eases the nervous system or decreases inflammation. And then there are things like interventional procedures like epidural steroid injections, so on and so forth, all the way up to surgery, which is something that a spine surgeon or neurosurgeon would complete. And even with treating on all those different fronts, which is what we call multimodal therapy, a lot of people either maintain the same level of pain or, you know, have some sort of temporary resolution, not even resolution, but temporary decrease in their pain. And that's all well and good. But if you don't have the right mindset to believe that you'll get better, if you don't utilize tools outside of what medicine offers, and this is where I'm getting to Reiki healing, and that would be going to your tools like acupuncture, Reiki healing, herbalism, and other different traditional medicine tools that are either have no side effects or are low in side effects. And these are all tools that have helped people over centuries and were available to us before there was modern medicine. So even though there was a movement during modern times to deem traditional therapies and herbalism and so on and so forth as hooey or as not valid in some sort of way because it wasn't a part of modern science, even though that occurred, it doesn't mean that they do not work. And just because their outcomes and the way that they work do not lend themselves to our modern ways of scientific exploration. So you're not going to be able to get a accurate result if you apply a random controlled trial to a traditional therapy, as opposed to and I'm forgetting the name, as opposed to, I think it's quasi-scientific trials that are more, are better in terms of how they evaluate the outcomes and the usefulness of certain traditional therapies. So either way, what I found was that people needed to incorporate more than what we could offer. And this is my dog, Max. People needed to incorporate more than what we could offer in modern medicine when it comes to chronic issues. So I'm talking about things like diabetes mellitus. One cannot eradicate diabetes, and I'm talking about type 2 diabetes, without diet and exercise. It's just not going to happen. It is rare, I would say, that medications alone, without including the lifestyle changes that are necessary, it's not going to be eradicated from the body like it can be when you do add or reverse some of the reasons or reverse the habits that have caused it. So adding something like Reiki healing is going to round out your treatment. I'm not saying that people should only use traditional remedies and methods or only turn to Reiki healing or only turn to meditation and mindfulness to or herbalism to get a good result with what they're treating. But using the traditional with the the Western medicine or the conventional is going to help to get you further in your treatment. So that's one of the reasons. I will post again I'll post tomorrow to list my second reason. My second reason is a little bit more personal. It's a little bit more about me. But my first reason is that more is needed when it comes to chronic illnesses. So I will see you tomorrow, and again, remember to live free and be well.